This episode is brought to you by Trillium Aesthetics. Let's face it, the weird look is having a moment. When you look around at celebrities, strange-looking eyes, overfilled lips, puffy cheeks, and faces that don't seem to move at all are common. You've probably started seeing this around you at the store or when you're out with your friends. Trillium Aesthetics is the place to go for non-surgical treatments that keep people wondering, did she have something done? What does she do to get such beautiful skin? The team at Trillium Aesthetics prides itself on results that whisper but don't shout. If you're looking for non-surgical treatments to brighten up a dull winter complexion, add a little pout to your lips, or erase some pesky smile lines, call the team at Trillium Aesthetics. Schedule online on their Instagram page at Trillium_aesthetics or visit the website trilliumaesthetics.com. Welcome to the Trillium Show, where we help you make the changes you want to see in your body, in your mind, and in your life. I'm your host, Dr. Jason Hall. Welcome back to the Trillium Show. So this is part 2 of a 2-part series with Dr. Deborah Durst with Revitalize MD, and we are talking all about hormones, hormone replacement, lasers, and other interesting topics which are coming up in this show. So if you missed part 1, please go back and check it out. You don't have to listen to it to get the gist of what's going on in part 2, but it's certainly interesting. It was certainly interesting for me to do. Please enjoy this conversation with Dr. Deborah Durst and Faraday Golombieski, her nurse practitioner.
External labiaplasty is something that, we do a lot of and are doing more of all the time. What do women who are looking for internal vaginal rejuvenation, what are the symptoms that bring them in? And then how does the laser help with that?
So it's interesting because like the hormones and the sexual vaginal rejuvenation
they
kind
cross
of
over
a lot because so if somebody comes in with hormone complaints, like the whole list of questions also goes through a lot of sexual questions, vaginal dryness, pain, orgasms, whether it's clitoral, whether it's vaginal. So, even what their drive is, all of that, because they cross over. So if they're coming with hormone complaints, we're almost talking to them about sexual wellness too. And if they come with sexual wellness, again, we've already talked about that cell optimization. So if they want vaginal rejuvenation, we talk to them about like how to optimize, again, results and lasting results. So they tend to complain urinary incontinence. So a lot of them have had children, so just the weight of the pregnancy obliterates like the support of the urethra. So
that's our younger women. Urinary incontinence and
vaginal laxity.
Laxity from pregnancy.
Decreased orgasmic strength is a huge one in perimenopause and menopause. And so it's going to go down with time. Men and women both have changes with time, different changes. Absolutely. And so vaginal dryness, pain with sex, intercourse, all of that. So laxity, urinary incontinence, pain, vaginal dryness, and orgasmic changes. Those are the big things that they're complaining about. And it depends on the age, depends on the patient.
Absolutely.
If they're young, they've had one pregnancy, they don't tolerate urinary incontinence anymore. Like it's unacceptable to, accept something as part of the process, like childbearing.
It's crazy how many women come in and they say, well, my doctor just told me to wear a pad for my stress incontinence. I'm like, what? Why is that a solution? Just wear a pad or an adult diaper. So we'll get a lot of...
At 35 years old?
I mean, right?
You'd be surprised.
Yeah. You're kidding.
How many women are like, my doctor told me to wear a liner. I'm like, what? Like that blows my mind that women are being told that. And we looked at a study not that long ago, and that was the number one.
Like 80%.
Yeah, like 80% of physicians are recommending adult diapers or pads.
For urinary incontinence, for stress urinary incontinence, 80%.
And that was
the
like
top recommendation.
2019. Like it wasn't that long ago that survey, it blew our mind. We're like, that is the most ridiculous thing when there are so many options out there.
Yeah, absolutely. You brought up urinary incontinence. One of the things that we do that kind of has the side effect of helping stress incontinence is a tummy tuck because you're part of that stress incontinence is a loss of, abdominal pressure from increase in domain so that fascia, the muscle layers stretch out. And so by fixing, your rectus or your six-pack muscles, you increase that pressure and can help for mild urinary incontinence, can treat it.
Wow, I didn't even think about that.
I didn't either. We talk a lot about platelet-rich plasma, the O-shot. We talk a lot about radiofrequency. So we do Votiva we talk about microneedling, internal and external. So that's one thing we've never really, that's ever crossed my mind for women. Yeah. We even talk about Kegels, right? So there's lasers out there to help do a HIIT workout for your vagina with electrical muscular stimulation. I mean, there's all kinds of things out there. We have probably a full suite of things for women's health, but that's one thing I've never really thought of for them to address. Yeah.
I didn't know that. I was almost thinking it would lift overall, but you're talking about you're containing. So it's going to improve all of that.
Yeah. It's a pressure solution.
And I almost want to get on into that abdominal plasty or surgical options, but also even body contouring. But I don't want to take away from the sexual just yet, because it's interesting because people come to us with like a weight loss issue or an issue that needs more than just body contouring, and body contouring is awesome, but there's an extent, it's beyond a level sometimes and they need surgical. And we could talk about that too, because I'm always very realistic. We are here, you can spend a lot of money doing body contouring, but if it's a circumferential thing and it's like skin excess, it's not something
we're not fixing that.
And skin excess and skin laxity. If you're seeing that patient, that hormone deficient patient with poor collagen and just floppy skin, even if it doesn't look like they've got a lot of excess, I see a ton of unhappy patients from Cool Sculpting or whatever.
We see a lot.
Non-surgical body contouring where they're not like you are, where you're looking at the skin and the kind of making that assessment, but just saying, toss them on the machine and we'll get rid of some of that fat. And then they end up either with no change or looking worse.
Yeah, correct.
Absolutely.
And I think addressing that comprehensively, just like the sexual wellness or hormones, and is important. So like, again, we'll do a lot of things like hormone optimization is going to already increase muscle mass, metabolism, help them lose weight. They're more energetic for a workout. We have peptides we can do, so that then you're controlling all the other aspects of it. So we do that way before we ever got into body contouring if there was weight loss that needed to happen first. But again, skin excess and laxity is not something, that can always be corrected.
And those patients were saying, this is surgical.
Yeah. Well, and just again, it's about them getting the results they want. And if you can't provide it, we need to tell them.
Right.
Exactly.
Because otherwise they're unhappy. And you don't want unhappy patients. They want results. So if they decide to proceed with something, despite you telling them, that's one thing, but you got to be transparent.
Yeah. And I think in our industry, honesty is with anything. Honesty is kind of first priority with everybody. Faraday, you tried to sneak another one by me. The O-shot. What is that?
So
I can't imagine catching you that you try to fit this in.
I just throw those things out there. We got all kinds of stuff.
It just like rolls off your tongue. I'm like, wait a second, what is that?
Yeah. So we take platelet-rich plasma. So we take your blood, spin it down, take the platelet-rich plasma from there, and then we re-inject that into the clitoral hood and in through the G-spot. So we are helping build collagen and elastin, supporting that urethra, and it helps a lot with stress incontinence for women. So we get that orgasmic improvement in strength, and then we also get to help support that collagen and elastin build in between the anterior vaginal wall and that urethra. So it helps some of that incontinence and laxity there.
And like nerves and blood flow.
Nerves and blood flow, of course.
With everything. So PRP started in orthopedics, with all of the growth factors in PRP and platelets. So when we take that and inject it vaginally, we're doing it right through the G-spot and into the clitoris. So you're going to get nerve regeneration and blood vessel regeneration. So you have increased blood flow, which is lubrication, increased sensitivity, and again, collagen, elastin, support of the urethra. So orgasmic, the O-shot, women love the O-shot, and we love to
it's a double whammy. Orgasmic strength and stress
incontinence. And it's not going to do an overall tightening of the vaginal wall. So like when you're talking about laxity, we're not going to be addressing that with an O-shot. We love to pair O-shot with our vaginal rejuvenation because you're going to basically do something to the vaginal canal. Usually it's heating in some way. So we have 3 different devices. So it's either RF heating, RF heating, but we're penetrating. So like a microneedling in the vaginal canal. And then, or we're doing the erbium, which we're penetrating with heat, telling it it's injured. So you get collagen elastin stimulation, tightening, and then blood flow and nerve sensitivity. And then we dump a bunch of growth factors in with the first treatment so that we have the shot going with the first treatment with amazing results.
How do you do anesthesia for that? Because I would imagine that just sounds like it would hurt.
No. Topical and a little bit of lidocaine.
Really?
Mm-hmm. A clitoral block.
A clitoral block. Mm-hmm. Yeah. Just so like with the P shot for guys, we do a penile block.
Yeah, we do P shot too.
Okay, just go ahead and lay it on me.
He's like,
guys say like 0, maybe 1 from that initial injection from the lidocaine for the penile block. Maybe a 1, but most men say on a pain scale of 0 to 10, they're a 0.
Okay. And what does that do? So, what does the P shot do?
Same thing for women. Increase blood flow, right? Elasticity, build that collagen elastin, help with erectile strength, blood flow, all of that. We're doing it. And we're usually pairing it again, like we pair women with Votiva or Morpheus B. We're pairing it with like a Gainswave treatment. So we're trying to improve that blood flow and then trying to get that vessels, right, to repair and hold all that blood flow in.
What is Gainswave? I'm not familiar with that.
Oh, we're just opening your world into all the sexual wellness. This is what we do here.
So we, again, talk about sex all day long.
All day long. Sex and hormones.
With hormones, we're talking about sexual stuff. And so, because again, people don't have a lot of places to go, right? Men or women. So, and we all age. We kind of talked about that earlier. We're all going to experience aging with time. So with women, it's laxity, decreased orgasmic strength, urinary incontinence, especially with hormonal changes or pregnancies. Where men, it's inevitable too, that eventually they're going to have decreased blood flow, decreased erection quality, decreased reliability. So they might lose like morning erections or nocturnal erections, or they can't consistently keep an erection.
Right. And women can hide it, but men can't.
Yeah. So
everybody in the room knows what's going on with you.
So they have different things, but Gainswave is an acoustic shock wave that basically is telling the tissue it's injured versus the laser for women. And so it's telling the tissue it's injured. So you get blood vessel repair. And again, the penile vessels are the smallest in the body. So they're 1 to 2 millimeters, coronary arteries 3 to 4, carotids even bigger. So it's a barometer of vascular health. So they're going to notice erection changes before they notice anything else. So you can so the earlier, the better. So if it's like, I'm maybe drinking, maybe losing an erection, can't keep it, but then maybe I'm not drinking. It's happening a couple times. That's the time
erections
to start
are changing
treatment.
In the morning.
Noticing minor changes. So you basically are doing it over the penis, over the scrotum to tell the tissue it's injured. So blood vessels and nerves. And then the smooth muscle, the corpus cavernosum, you're going to improve the health of that, collagen elastin. So when we get the blood flow in, we want it to stay. So the P shot kind of focuses in on the penis and all the regeneration there. So likewise, we do Gainswave, pair it with the P shot.
Dump all those growth factors in.
No man left behind. We can't do women and not men.
We do women and men.
Yeah.
Mind is blown. Yeah, I was reading your website, and which is beautiful, by the way.
Thank you.
I was looking, I was like, I don't know what half of this stuff is. Like, I've got a lot to learn.
Well, we don't learn, we don't learn hormones in traditional medicine. We're both traditionally trained, and you don't learn it. And I think endocrinologists don't even know it because they frequently don't have women as they age on estrogen or on the right thyroid replacement. So you have to almost branch out and learn it. But like what we're doing is on the realm of regenerative medicine. So lasers are regeneration. So now we're starting to talk about how to regenerate. And I think that's the next step. Like that's almost like a revolution in and of itself. Not the sexual one. This one might have boundaries, but this one is awesome because you're using, you're basically regenerating tissue instead of sometimes cutting or using medicines for it, if it can. So if it's mild. So if they're coming for, it's almost as if med spa versus surgical, like your filler is augmenting what you're doing surgically and they're working together. And so that's frequently what we need for tissue function too. And sexual function is we need everything to work together.
Yeah. And that's, you bring up the surgical part of it. That's plastic surgery is moving, has been moving in a regenerative direction for a long time. And, we're seeing more and more regenerative treatments kind of take over. It's unusual for me to do a facelift now without pairing it with fat injections. Fat grafting to the breast, to the buttocks, all over the body has kind of become really standard in a lot of practices.
Or even more contouring, probably with filler, you know, all of that. Or regenerating with lasers. So it's a more comprehensive treatment than it ever was before. So they went to surgeons for surgery. And now that's a comprehensive treatment.
Right.
And it's almost as if that's all that's offered. You know, they're probably going to not be as completely happy with the results because you're going to pair, you know, some contouring. So that looks great, but let's add some contouring or laser regeneration and all that. So it's kind of the same with us. It's the
then again, back to cell health too. We got to add those hormones back in. We got to treat that base function of that cell. We've got to make it as healthy as possible, make the body as healthy as possible so that when we're doing these treatments, we're not seeing regression sooner than we should.
Yeah. And then actually when you're talking about building bone, so like, again, when it comes to the earlier women are on hormones, so as soon as they can be, the better. So perimenopause, 40 to 55, seeing it younger now because we don't produce hormones like we used to, toxicities that we're exposed to. But the earlier you replace progesterone and testosterone in the perimenopause, the better, because the only thing that maintains or even builds bone. So if they have like low DEXA scans and their osteoporosis or osteopenia, you can actually build bone with hormones and hormone optimization and vitamin D. So that's the other thing we don't ever think about. You know, it's a pro-hormone, but it actually builds bone too and supports bone health. So then they get less bone resorption with time. It's still, you're still going to have aging. You can't correct everything, but at least you can support
and slow it down a little bit.
Yeah.
Oh, absolutely. Absolutely. Another question, kind of not to shift gears, but shift gears a little bit is you've got a really comprehensive lab in the back of your clinic for IV therapy. And that's been something that has been talked about a lot recently. How can IV therapy help in the kind of the post-surgical period? And I'm kind of being selfish thinking about my patients recovering from, 3, 4, 6 hour operation. What do we use? When do we start? What do we need to partner to help optimize post-surgical recovery?
So you get all that recovery. Yeah. So high dose vitamin C has been shown in lots of studies to promote healing after, mainly because it's an antioxidant. So it's, decreases inflammation, oxidative stress, all of that is happening post-surgery, right? If they can do it before and almost immediately after, there's no complications. It doesn't increase bleeding rate, nothing. So it's not going to make anything worse with surgery or in the recovery period, but can significantly improve recovery times because it's anti-inflammatory. And so you get that inflammation, and that's mainly what causes swelling and pain, right? And at least I'm thinking they can't decrease or they can't move like they used to because it's a lot of pain and swelling. And so that's high dose vitamin C all the way. And in fact, used for cancer therapies or at least preventing side effects with chemotherapy. So there's lots of benefits to just IV, promoting healing and making your patients get better faster.
Absolutely.
Maybe come wobbling into the post-op, appointment because that's probably a very hard appointment, and lots of pain with it. So here we put together all the drips. You can actually even talk a little bit more about that.
So we do a ton of different IVs. We do, like Dr. Jer said, the high dose vitamin C. We do kind of like a souped up Myers cocktail. So all of your B vitamins, some minerals. We do glutathione added on to a lot of our IV drips. There's alpha lipoic acid. So a lot of things to help with antioxidants, healing, just overall to feel better, getting that energy back. We do NAD drips. So that is also DNA repair, just quite a bit. We customize a lot of stuff. So even for our athletes, so post-workout for recovery, we do amino acids. We add glutamine, arginine, lysine, valine, and I'm missing one, but there's another one in that mixture, carnitine, to help with recovery after working out. So we have a pretty extensive IV lounge here that we are sitting in today that our patients can come and be here anywhere from an hour to 6. Depending on the drip.
That's a pretty comfortable place if they're post-op and a little uncomfortable. We have some rooms too, but the history of IV therapy, because it's interesting, because it's been used for a while too, but because nothing is drug company sponsored or supported, it's all about the money. And if you follow the money, it's so easy. But now they're actually, I think in 2021 or maybe the early part of this year, they just came out with high dose vitamin C as part of cancer therapy, like not just preventing side effects, but cancer therapy. So some studies recently and just using high dose vitamin C for cancer therapy is not just in like an adjunct to cancer therapy or preventing side effects. So it's been around for a long time, but because drug companies don't support, can't do studies, it isn't as promoted as it's going to start being, I think. So what typically would happen is regenerative medicine doctors, the ones that are doing like all the functional medicine doctors. And again, that's not us. That's doctors that are doing like really sick patients with, Lyme disease or something big, and they're working through it. And it's a lot of work to get
through with the gut health and the microbiome and all of that. Very
they need
extensive.
to have they're very good at what they do, which is why, because it's so detailed. And so they have to specialize in it. But they would do drips to treat those patients over like maybe 4-hour periods. So I did my training and learned these long, very complex drips and multiple trainings. And then I realized nobody's staying here for 4 hours to get an IV therapy drip. So I basically took and reformulated those to go over an hour. And it's based on osmolarity and blood. And so like if you're giving lactated ringers and normal saline, it's like approximately 300 milliosmoles per liter. So your drip has to be close to that too. So that's the nice thing about it now. It took a long time. It took me about a year to formulate prior to even this being open. And then make
she does have a pharmacy degree. She doesn't talk a lot about that. She was first a pharmacist before a physician.
Well, so I got very
she talks about it like no big deal. I just created these.
Just make a 300 milliosmolar solution.
It took a lot of learning, but it's very I loved it. And as I learned what you could do with IV therapy, again, there was no way I wasn't putting an IV therapy lounge in this place because it's just an adjunct to everything we do. And so we do formulate, customize, so we can change because we know the science behind it. So high dose vitamin C is technically 25 grams, but we can do 50 grams. We can do 75 grams if we wanted to. Yeah. So we can customize, which is nice.
And those might take a little bit longer just because of side effects. Yeah. And then our NAD bags do sometimes go 4 to 6 hours, but NAD the majority of them.
A great, again, it's used for addiction, alcohol, drug. You can titrate up and titrate down, but it's great anti-aging mitochondrial support too. And then I think the big thing for us for beauty is if you put glutathione in anything. So for you, recovery post-op, they, as soon as they can get in, and they should always do one before because it improves it already. Because every, vitamin C and high dose concentrates in the white blood cell. So your immune support and anti-inflammation is highest in that perioperative. And then if they can get one after, it's even better. But a lot of times they're in pain and it's hard to do. But then glutathione, because it's the master antioxidant. So all of Hollywood's doing the glutathione drips, just for skin brightening and, making everything brighter and lighter. And so that's a big selling one too. People come looking for it.
Great for aesthetics, but also just because it's an antioxidant.
Yeah.
It's wonderful for the body.
Mm-hmm. How long before surgery for some of these, glutathione, vitamin C infusions, how long before or how close to their surgery would you recommend somebody come here?
So I would do it within 24 hours of their surgery, right before. It's not going to interfere with your surgery.
Okay.
And of course, everybody out there, talk to your surgeon before you go and get an IV. I feel like we have to say those things, of course.
Well, absolutely. You don't want to let your surgeon not know what you're doing.
Exactly. Right. Very important.
You might find out they won't do surgery when you should.
Right. Exactly. I'm I got to throw that little caveat out there.
Yeah, I would
always double check with your surgeon before you do that. Always, but we do see patients here pre-op and post-op.
And the other interesting thing is peptides. So again, there's 2 peptides in particular that come to mind with this. And so it's all part of that regenerative. And once you hear about it, you'll be learning. I know you.
Oh, yeah.
You'll be reading all about the peptide, everything. And again, as that regenerative medicine thing just expands and blows up, you can't help but get excited to learn more about it. And I think Tony Robbins' Life Force book is kind of bringing that to the public.
Sums it all up
If we don't keep up, they come in asking us about certain things that we don't know anything about. So you almost have to stay up. Mm-hmm. But, and I know it won't, it'll be on the way home.
Oh yeah. You mentioned Tony Robbins' book. It's on my Kindle is next up. So
I just started listening. I've had so many patients come in and they're like, have you read it? So as soon as I hear that and I started listening and it's exactly what we would love to learn about. But peptides are like, again, one of those regenerative medicine type of things you can do. So BPC, CJC, have you heard anything about this?
I've only the letters.
Us peppering it in here and there in conversation.
But talk to me a little bit about the peptide.
So growth hormone, for instance, like the growth hormone thing is like in the 90s started to be more restricted. So before that, it was being used for injury. And so a lot of athletes with injuries, they would go on growth hormone, and obviously it has great benefits. If it could be a drug, it would be perfect. It'd be a perfect drug because it has, decreased inflammation, healing. I mean, it does everything that testosterone does, but better. So libido, brain fog, energy, healing, decreased inflammation,
decreased
endurance.
lipid profiles.
Decreased injury. Now it's restricted and you can't use it much, but now there's a peptide that can increase growth hormone. So CJC 1295 and epimorelin
will help the body increase its own naturally. So we're not giving it external. So we're not shutting down the body's production, which is so important. We're just supporting its own natural production. So it is not something you have to worry about being on long term. A lot of these drugs that shut down the body's natural functioning, you've got to take that into consideration when you're starting a patient on that, because you don't want to do long-term damage. This is one that it will promote the body's own natural increase in growth hormone and mimic its natural rhythm at night and in the morning. So it's pretty cool.
Interesting. So it's like erythropoietin or EPO for the audience who's kind of heard about that, to increase blood production.
Absolutely.
It's the same thing for growth hormone.
Absolutely.
So now you can optimize not only hormones, and I always recommend hormone optimization first, and then we'll add growth hormone optimization. So CJC 1295 is growth hormone. It looks like growth hormone. It's a shorter segment of growth hormone releasing hormone. So it goes to the pituitary, has the pituitary increase growth hormone production. We still have small spikes as we age, but it peaks at 20. And so then it starts to go down. But they're still there. They just need to be stimulated, but not overstimulated. And growth hormone, if you're giving it, it's doing the peripheral effects and then it's shutting down your own system. Where this increases your growth hormone, goes to the liver and produces IGF-1, which does all the effects, all the positive effects of it. So it doesn't shut it down. And it also doesn't overstimulate if it's dosed appropriately. And of course, you have downregulation of receptors. If you take it on a continuous basis, they used to cycle it every 3 months and come off of it for a month, but now you can do it. It's an injectable at home. Most of the peptides are, if they're really effective, 5 days on, 2 days off, 5 days on. And so it just stimulates enough, doesn't overstimulate, doesn't shut down. But now you have growth hormone optimization and all the positive benefits without the downside.
Without the negative side effects.
Now, is this another, we talked earlier about being able to measure hormone levels. Is this something else that you measure and kind of track when they're on the peptide treatments?
So you don't with this. So it's a small segment. So even measuring growth hormone is expensive.
Yeah.
And so this is growth hormone releasing hormone, but it's a small segment of it. So it's like 29 amino acids. So like you're not going to ever be able to measure that. But even then it was expensive. But you can measure IGF-1 levels baseline and you can measure them post. The only
pre
issue,
and post, we do it pre, finding that initial always as a screen.
The big issue is like pre, you want a baseline that tells you it's at least at a level you're going to produce so that your pituitary is working enough and those somatotropes are working enough that they're going to work for production. But you're not going to get sustained. So by the time they're in here getting blood levels, honestly, you're not going to see a sustained because the half-life is 30 minutes, just like growth hormone releasing hormone. Goes to the liver, produces IGF-1, does the effects, and then it's gone. And testosterone was a third generation. So if anyone ever asked, like Samorelin was first generation.
Those are the Arnold days.
Yeah.
Right?
What the Samorelin said. Yeah. Well, and I think some places still use it, but it does have effect on prolactin and cortisol. And so it affects other hormones. So you have side effects with it. And then you have CJC, which is second generation, which I think is ideal for use. Testosterone was a third generation, temporarily not available, but because it wasn't a regulatory, I think something to do with COVID, honestly. Most of the peptides, if they went away for a short period of time, was because somebody was using them, in the COVID scenario.
Somehow or another, and it got pulled.
But it does get you sustained results with that, which is really not what you want. So it was used in a more short term for somebody with maybe like abdominal, like metabolic syndrome. So if a man comes in, or a woman, again, like with metabolic syndrome, then that was a better peptide to use. But
short term though.
Yeah.
Not long
Short
term. Where CJC epimorelin, we can stay on long term.
Okay.
And you actually see better results long term.
When you say long term, what's a treatment course?
At least 6 months before we tell everyone, give it at least 3 to 6 months to start seeing sustained benefits.
So 6 months is ideal, because you're going to get your biggest strides, like Faraday said, in 3 to 6 months, but you can stay on it indefinitely if you want, because it optimizes growth hormones. So it prepares your body not to get injured, and your like endurance is better. Your muscle building's better. So honestly, for women, and you can cycle them off and back on, but without tumor history, then there's not that contraindication. But for muscle, for women as we age, again, one of the biggest complaints is weight gain and body composition change. So that's why, all of a sudden we're seeing sagging. We want arm surgery, even the thighs, which I'm not sure there's a big,
top
I don't
of the
know
knees.
how much you can do for like above the knees in abdominal. And so this actually does a great job at body composition changes. But again, it's a slow process over time, because you're optimizing growth hormone again.
That's really interesting. I was totally unaware that you would start seeing surface changes with something with a peptide infused. That is really cool.
And then epimorelin is paired with CJC typically, and epimorelin just inhibits the negative feedback on the pituitary. So basically, they're both increasing growth hormone, but they're used together usually. So
very
cool
neat
stuff. Yeah.
Well, as you were talking, you kind of mentioned the testosterone, and had a question about testosterone and some of these like propecia, because I know a lot of guys who are in my demographic are concerned with hair loss or thinning. And, how does testosterone and propecia work together? Can you get testosterone supplementation if you need it and still be taking propecia for your hair? Do you need to?
So we can go on forever about this.
Forever and ever and ever. So testosterone converts into dihydrotestosterone, which is 10 times more anabolic. And so when we're seeing our patients for testosterone, male and female, because females can see that same, because it's the same pathway, we're always looking at those DHT levels. So there are medications that can slow that conversion so that we're not seeing that excess hair loss. There are some natural supplements like saw palmetto, right? So we put patients on minerals. We put patients on some supplements sometimes to help with that. But spironolactone is great to slow that conversion of testosterone to dihydrotestosterone. We can also hit those follicles at the site and do topicals to help minimize that DHT response at the hair follicle site. So there is a lot of options there for men and women that we watch on the front end. So we grab those DHT levels on the very front side of it. Some of the patients we see that have come from clinics that are just running shots weekly, right? They're not looking at any of that. So we're correcting that when we come in.
So I think it's almost like dosed appropriately, treated appropriately, followed appropriately.
Exactly.
You can prevent any side effects that you're going to get, and, and dose appropriately so that you don't get also not just side effects, but adverse long-term effects. So I think getting more data points at the beginning, like a DHT level, what's your free testosterone, your binding globulin, like all of those are important. Dosing is appropriately done so that, like, again, pellets, is something that you make a small incision and you insert pellets under the skin that slowly release. And so that slow release, keep your levels up and keep them up, versus injectables. So that once a week at the low T clinic, and then down, and down. And creams don't work. I mean, nobody feels better in creams, but they're like a variation. And so the more that you go up and down, we want testosterone. But if you're going up and down, you're getting those variations. When you're peaking, you're converting. So estrogen for men, man boobs, like because again, I want men to know that there's options. And so the once a week is not a good option. I mean, we do injectables, we dose it differently. Because once you get an adverse effect, it's harder to treat, like hair loss or growth of
playing
breast tissue.
Yeah.
And so,
or we're sending them to surgeons.
Yeah.
But again, it can. So DHT, even if not high, can concentrate in the hair follicle, like Faraday said. And so putting a topical on like Propecia, but you never want to take, the most important takeaway from all of this is you never want to be on Propecia without testosterone optimization, because there are lots of studies that show erectile dysfunction that they report to be irreversible. So if you're not optimized, so self-treatment over, the internet treatment, like, hey, I want testosterone, not a good option, because that's when you run into trouble. You want to go to somebody you trust, testing everything, but also even if it's concentrating at the hair follicle, if you want to use finasteride, that's the way to use it because you're just using it topically and it prevents that conversion at the hair follicle. So
that's good to know.
Yeah. I mean, it's complex and it's what we love, but you have to know and manage it well to prevent and even then sometimes we'll run into issues. So it's troubleshooting, problem solving.
Absolutely.
And a lot of that can be based on a conversation.
And then good relationships with compounding pharmacies because those pharmacists have all kinds of fun little concoctions they can make for us.
Oh, I bet.
Yeah. And there's a couple really good ones locally.
Absolutely.
That are a wealth of knowledge if ever you have questions about dosing or a different route or
I'll just send it to you.
It's all good.
You send us the hormones, we'll send you the certification.
I'll just send those to you. That is above my pay grade, as you can tell by the questions I've been asking.
No, I think it's a great conversation to have because everything that you're doing, is a comprehensive approach to it and knowing.
We treat the inside and the outside.
Yeah, I think that's kind of the takeaway. That's what I've gotten from this is that aesthetics kind of, they say beauty is skin deep. It actually isn't. It
goes deeper.
It goes much way deeper. Yeah. And probably the best treatment is a marriage of the surface treatments, what we can do with our lasers, injectables, things like that, surgery, and then hormone treatments, peptide treatments, IV infusions. I mean, it's
absolutely overall wellness.
Yeah, it is.
We want every patient to be the healthiest version of themselves they can be when they walk out these doors.
Absolutely. I couldn't agree more.
There is one that we haven't talked about.
What?
I'm like,
I know.
I'm crazy.
It's our favorite.
So
What's
BPC is a peptide that we haven't, and this is actually a great perioperative. There's just one more. The two peptides that really work are CJC for growth hormone.
Yeah.
And again, for even us, using peptides to optimize and, we want to be our best selves for our patients too.
Absolutely.
And again, if we're living examples, they want to live it too. So they want to see their providers doing the same things, right?
Yeah.
Or having personal experience so they can talk about it.
Yeah.
So BPC 157, BPC stands for body protective compound. It actually decreases inflammation, wound healing. It helps with tendon healing and ligament healing. It is amazing. We see this for patients with acute and chronic injuries. We see a lot post-operative. We have some local physicians that will send their surgery patients to us for BPC to help expedite the healing process, the recovery process post-surgery.
Is this something that you could do before surgery to help?
Absolutely.
And the quicker you can do it before, definitely 30 days before, but if you can be on it even longer. Once you learn a little more about BPC, you'll love it as much as I do. It's, again, just...
Out of all the peptides, it's probably the one that, nothing in life is immediate gratification, but this is a peptide that within 2 to 4 weeks, patients have relief of pain.
Wow.
It is amazing. It changed my husband's life. So personal experience, my husband was walking around with pain of 7-8 every single day on a 10 scale with chronic back pain. He was very active athlete, very hard on his body. With BPC, he's down to a 0-1.
Wow.
Just because of inflammation and the compression on nerves and just overall just that pain in the joints.
They come in with an acute injury. So a lot of patients remote with BPC because it's hard to get peptide physicians and appropriately prescribing physicians nationwide. So they will reach out remotely, even if they have, so if it's local remote, they have an acute injury that they want. And again, they're on the internet, right? Searching. So they're BPC, what helps with? There's so much. Have you heard of Ben Greenfield?
Oh, yeah.
Yeah. So he does a blog on it and basically says this shit should be illegal. It probably will be soon because I had improvement of this and everyone's talking about it. There is tons of stuff on the internet. So when they reach out, if they have acute injury that we're treating, if they have some chronic pain, it's gone too. But for surgery, the quicker you can use it before, and definitely 30 days is a good time frame. You're prepping the body. You can do it perioperatively. Again, no drug interactions. It's not a drug. It's not going to affect surgery. And then post-op, it allows inflammation, but not too much. So most of the healing, that takes so long is because they're inflamed. It's painful. They can't move. In the orthopedic results are phenomenal. And so as orthopedic surgeons start to use it more and more, sometimes they don't need to do surgery, but if they do, they're getting faster recovery times. So,
can you combine the BPC injection with a vitamin C infusion?
yeah,
Absolutely.
Yeah.
You can combine it with CJC. You can combine it with testosterone. You can use it really in conjunction with any of the therapies that we do here.
That's very cool. I'm definitely going to have to look more into that. That's definitely cool.
It's like one of my
probably my favorite. Just like across the board with our
waited
patients.
to the end to talk
I
about
know.
it.
Food for thought.
Hey, she snuck a lot in.
She
I
did.
did.
Yeah.
Usually just I'm like, oh, BPC, CJC,
Yeah, she couldn't let this one sit
testosterone,
down.
P-shot, you're good.
Yeah.
There's your order.
Yeah.
What was the order again? I'll have to listen to the recording.
Exactly. So anything else you think we need to for hormone or Dr. Hall?
For healing, definitely, we've kind of hit the two main ones. With surgery with peptides is that CJC, ipamorelin, and BPC. But it is amazing, the BPC results, the feedback we get from patients. It's been so life-changing for so many of our patients. I think that's why it's probably my favorite, because you get quick results and nothing in life is quick. And I feel like a lot of times we just put Band-Aids on things, steroid injections, right? Let's just stick some cortisol in it, and then we're just breaking down bone versus a functional change.
That is really, because that is, a lot of Western medicine is putting Band-Aids on things.
Yeah.
And so this is
Functional change
exciting.
is pretty cool.
And
Exciting to
just
hear about.
knowing that there's so small a percentage of patients that your surgical patients that are even hormonally optimized, and knowing decreased healing time, anti-inflammatory effects, the healing times, the immune support, just hormones alone, just knowing as your patients, listen to this and, are prepping, and as you're talking to them, I'm sure they have a period of time. Everything's a wait time now, right?
Mm-hmm.
You can't, so they have that time where they can at least start thinking about it beforehand and help you, get results that are quicker.
For sure.
More sustained, better, all that.
Yeah. That is certainly true. Like I said, I've learned a lot today. This has been a lot of fun. Is there anything from you have that your patients would want to know about surgery as it relates to hormones, or just in general?
I think the biggest ones are kind of, do we need to come off, right? That's always finding a surgeon that is not going to freak out that they're on hormones, right? With pellets, we can't really remove the pellets.
You can't do anything about it.
Right? So if it's something where if we're doing an estrogen pellet, if we need to wait, what does that look like for the patient? Can we go to a transdermal if we have to? And then downtime. I think that's always like the biggest thing with patients too is, well, if I'm doing XYZ with you all and then I'm doing surgery here, what's my downtime look like? How much time would I have to be off hormones? How much time do I have to wait till I get to the gym? Because that's big. A lot of our patients are doing a lot of just self-improvement. They're in the gym, they're working out, they're doing all of that. They're working with a trainer, trying to get those body composition changes along with surgery.
Sure.
So what does downtime look like with most surgeries, timeframes?
So that's a question that I get a lot. We kind of go over in the consults. And for most surgeries, I guess a general rule would be you're pretty much off of anything for about 2 weeks. After about 2 weeks, then it's kind of light exercise, thinking treadmills, walking around the block, maybe walking up and down hills, get your heart rate up a little bit. But really 6 weeks is kind of the cutoff for intense exercise. I tell a lot of patients, whether it's tummy tucks, breast surgery, facelift surgery, typically no lifting and no bouncing for 6 weeks. And then,
No bouncing. Of any kind.
Of any kind.
Stay off the trampoline.
You determine what bouncing is for you. But it's so 6 weeks out of the gym for sure. I want patients to be up and moving the day of surgery. There isn't laying around is where your complications happen. And so up and moving to a point.
For someone that's getting a facelift or doing fat grafting into the cheeks or into the face, how soon can they do laser resurfacing?
That's a great question.
It's a really good question. It depends on what else is done. Injections typically do laser resurfacing same time.
Yeah.
The tricky part is with a facelift, because you don't want to, you have to lift the skin up to reposition the muscles and do all the work that's needed to get the result. And you don't want to stress the skin by lifting it up and then set it back down and blast it from the top with a laser. And so you have to be really careful over that skin that has been elevated. And so it's a matter of matching the right procedure. You know, if we're doing a deep plane facelift, that is typically really limited skin undermining, you know, above the jawline.
Okay.
And so I can be more aggressive with laser resurfacing doing that is if we're doing a smaller facelift that, with less muscle tightening that relies on a little bit more skin undermining.
Okay.
Gotcha.
What about treatment for scars? How quickly for treating with either creams or lasers for scars post-surgery?
Really, almost after the tape has come off.
Love it.
It
Love
is
it.
right after, you know, because that you're looking, you know, scar is essentially healed less than a week. If it's, you know, if the skin edges are put together right, you know, that skin has healed over in about 48 hours. We want to let it kind of thicken. But then, you know, once that tape comes off, whether it's a week or 2 weeks, you can start
after it.
laser treatments right then.
Love it.
But again, talk to your surgeon before lasering a
I'm like, you
surgical
gotta throw that
scar.
caveat out there always.
Absolutely.
Yeah.
Because that's what they just said. We were a little surprised at the most recent conference we were at. They're like, as soon as everything's off. And we're like, it seems so.
Even like
quick.
vaginal
So glad to
treatments
hear
are like
that.
the day the baby comes out. I'm like, what? Like in other countries.
They were talking about more also stretch marks.
Yeah.
So if you have stretch marks, as soon as you deliver,
Come on.
get on, you know, because they're darker at that point and the ribeye versus, you know, a scar tissue once it's white. So
Yeah. Stretch marks are tough though. I mean, stretch marks are tough to treat.
Yeah, I agree.
But we have some things for that.
Well, and I think that like just the fractional like erbium is really good as if
Sooner the better.
Yeah. Fractional erbium and then, you know, for the purples or reds, you can zap those.
Yeah.
You know,
much more responsive
too.
Yeah. So
much better than the white.
Yeah.
Gold.
Yeah. Once they're white, you're in for kind of the long haul to get to improve.
What about with the fat transfers? Is the fat transfer when you do it, is that like how long does that procedure take? Is that an in-office procedure? Is there a lot of downtime with that versus like a surgical?
So it really depends on what we're treating. If we're treating a small area, even treating an area like the backs of the hands, those are good in-office procedures. When we start talking about full face rejuvenation with fat, it tends to be a little bit more involved. I like to do those in the operating room. The procedure length, if I'm doing it in our surgery center, which is right below my office, a full face fat grafting session can take 45 minutes or an hour. It's not a lengthy procedure. In the office, it tends to take a little bit longer just because you're awake. We want to make sure you're comfortable. Things are a lot slower because we're making sure that every little area is properly anesthetized before we do anything. The real recovery with fat transfer is not pain, it's swelling. Because fat is you guys know, fat is very inflammatory. And so especially in thinner areas, so around the eyes, around the mouth, the lips especially, they tend to really swell. And so you have to budget. I tell people, you know, give yourself 2 weeks before you're really out in public because you'll be noticeably swollen.
Okay. That's interesting. So it sounds like almost if you're going to do a decent area, the operating room's the better place to be for those procedures.
It's much more comfortable. Yeah. It's just more comfortable. And I know some people
and that's a huge part of it when these are all, you know, extra. Nobody has to. They're elective, right? We want everybody to be comfortable.
Yeah. It's surgery you want, not surgery you need.
Exactly.
Right? So the operating room is kind of my preferred venue. But if the patient wants to, you have to have the right temperament. If you're an anxious person, you know, having facial fat grafting in the office when you're awake is not the right procedure.
You're doing all procedures, all operations at an independent surgery center. So like more control over even anesthesia and patients entering and leaving and much more private circumstance than at a hospital based.
Right. Yeah. So our office, I'm very fortunate that my office is directly above the surgery center, and the only thing that the entire building does is cosmetic plastic surgery. So we have the same OR team. We've got the same team of anesthetists. We've got the same nurses at the same building. That's all we do every day. And so we've really, over time, taken great pains to make the entire experience from kind of start to finish as comfortable, private. You're not going to run into your friends or, we see a lot of nurses, a lot of healthcare providers, physicians, and they don't want to run into their friends as they're asleep and half naked and having cosmetic surgery.
Yeah.
Exactly.
Yeah. Correct. Or go to the hospital. A separate registration area, and then you're in a waiting room that's public. And so there's so many downsides to doing it at a hospital based.
Yeah, it's really been a fantastic setup.
That's awesome. I love it. No, I knew that was a huge advantage, big advantage. Because a lot of patients, I mean, again, just like you said, they want privacy. Yeah. And that hospital experience is anything but.
Plus, you're stuck with hospital equipment. You're stuck
with hospital guidelines.
And hospital guidelines. And,
hospital requirements.
Yeah. Our surgery center, to speak to that, the surgery center goes through the same accreditation process that the hospital does.
Oh, I'm sure.
And so from a safety standpoint, from all that is exactly the same. It's just that administration.
There we go. That was a really nice way of putting that. That was very PC.
No, I think that in addition, though, I think you have, even though you go through the same accreditation process, you probably have better treatment protocols, anesthesia protocols.
A little bit more stringent.
Recovery, things aren't controlled. So likewise, better administration.
It's geared towards aesthetic patients.
Yes, love it.
So
it's a big difference.
Yeah, it is. It's really been a fantastic setup.
That's awesome.
Well, awesome. So it sounds like we've covered a ton. I love it.
This has been a lot of fun.
Yeah,
this has been a lot of fun.
We're doing this again.
Absolutely.
At some point,
Let's do
for
it.
sure. So I thank you so much for being part of this.
Thank you.
And actually initiating. I love it. That's perfect. We have so much to cover in the future. We can talk about so many different things.
Different procedures, different lasers, different treatments.
Yeah,
and I'm sure
could do whole shows on
this.
Absolutely.
Yeah, we might even, if we're doing a RevMD, just an open forum, and we need a guy present for, the guy opinion, we'll bring Dr. Hall on, right?
Totally.
Yeah. He'll let us know for sure.
For sure. Yeah.
Well, good. Well, again, listen, subscribe, share with friends, leave some comments or even your experience or questions. And we're willing to deep dive into anything wellness and aesthetics. And thank you, Dr. Hall and Faraday, for making this such an interesting segment and podcast. It's been wonderful. So thank you.
Absolutely.
Thank you. Yeah. Thank you both. All right, everybody. I need that little exploding head emoji. I learned a ton on that show. I hope you guys had a good time. Please, if you haven't already, ring the little bell on YouTube, like it, subscribe it, share it with your friends, and we'll see you at the next show.
Thanks for listening to The Trillium Show. You can keep up with the latest on the podcast at jhallmd.com. Be sure to follow us on Spotify, Apple Podcasts, or wherever you listen to podcasts. If you want to connect with us on social media, you can find us at jhallmd on Instagram and Twitter, and Dr. Hall Plastic Surgery on Facebook. Remember, be the change you wish to see in the world.